I'm Alexia, and with me today is Dr. Watson, and we are here to discuss our asthmatic patients in the midst of our COVID pandemic. Dr. Watson, what do you have to tell us for today?
Well, as you know, this period, the COVID-19 pandemic, has caused a lot of stress on most of us, and especially those patients, our patients
Right.
who have chronic diseases, and asthma is one of them. So
Right.
what we want to say to our asthma patients today is that you can get through this,
Right.
and we are here to support you. We just want to remind them, however, that the guidelines have changed a bit.
Yeah.
Because we are now advocating that instead of using just your reliever medications, you would use both your reliever
Right.
and your controller.
Right.
So what they know as the blue pump and the brown pump, you would be using both.
Together.
Because what has happened is that the studies are showing that when you use one, the reliever alone, the incidence, the frequency with which you get an exacerbation or end up in the hospital
Right.
is increased.
Right.
So just a reminder, don't use one only, use both of them.
Right.
And the next thing is that the things that may trigger,
Right.
the asthma. Allergies, we know. Right? But in this time, in addition to the dust and everything else, the pets, we also have the stress and the anxiety of dealing and coping with COVID-19, the constant lockdowns, the uncertainty.
Right.
So we are encouraging our patients to find ways to deal with it, to relax, and
Right.
to just remember that, we can get through this.
Right.
The other thing that I want to talk about is the preparedness. One of the things that will get us over that anxiety is knowing exactly what to do and
Exactly.
having your medications.
Right.
So we want to remind them about the action plan, the asthma action plan.
Right.
We want them to be familiar with it. The action plan will tell you which zone you are. Are you in the green zone, which means that you are okay? In the yellow zone, it means that you may be losing
Experiencing some
control.
symptoms, right.
But once you get to the red zone, that means that you are maybe running into problems.
Right.
So your medications, you should have good supplies of your medication, and the action plan will tell you what to do. If you are in the green zone and move into the yellow zone, what you must do, and if you are in the yellow zone and move into the red zone, what you must do.
Right.
So if your medications, if you don't have the medications, be prepared, because you don't want to be in a lockdown
And you're
out
out
of
meds,
medication.
exactly.
And most of the insurances are allowing you to take extra stocks
30 to 60
of,
days, right.
of medication. So this asthma action plan is going to help you to be prepared and to help you to avoid the anxiety that is associated with
Perfect.
the asthma.
Perfect. I love that, Dr. Watson. Earlier you mentioned a few triggers for our asthmatic patients to try and avoid as best as possible. In addition to that, I know or read now with the hand sanitizers, but some of them are so highly scented that these actually can trigger asthmatic attacks. So preferentially, we want to encourage hand washing.
Hand washing,
right?
right.
And then if or when we do use a hand sanitizer, use something that is scent-free.
Right.
Still within the 70% ethanol component, but scent-free, right? And with so much information out there on the web, on social media, it's a lot to sort through. So we have to kind of ensure that whatever material we're focusing on, it's from a credible source, something that you can trust, whether it is from your local government or through the CDC website. Stick to that material and try and tune out everything else that can be distracting you.
Exactly.
Right. Earlier, you actually made mention of the importance of your action plan, the asthma
Right.
action plan. And it's interesting that as asthmatics, we really want to encourage them to know how to use their peak flow meter.
Right.
And it's based on these readings that's going to allow us to see exactly where they are on the action plan.
Right. And also to remember, just to remind them that they can, for the asthmatic patients, where sometimes their oxygen levels may fall, the simple oximeter, which
Right.
is available at most pharmacies, and they can keep at home. So whenever the oxygen level starts to fall,
Right.
if it falls below 95,
Right.
then they know that they may be in trouble, and that is another reason why they should seek medical attention.
Perfect, perfect. So now as we go into the use of our peak flow meter, this is the device. This meter is used when we are at our optimal level, not when we're having any triggers or any asthmatic attacks or symptoms of asthma. So So what we're going to do is to fully empty our lungs by breathing away or breathing out away from the meter. Then we're going to take a deep breath. Then we're going to place our mouth around the mouthpiece and breathe forcefully and fully into the device. We're going to record this reading, move the pointer back to the original at the base, and do this 2 more times. After getting 3 readings, we're going to use the highest of the 3 readings, and this will be our referral for our action plan. And of course, Dr. Wati, we can't forget the need to vaccinate. And I know for our asthmatic patients, there might be some concern, especially if you are on an oral corticosteroid at a high dose or for an extended period of time. But don't worry, we're all here to help. Speak to your physician and remember to maintain the protocols.